Well, joining us now is Africa 54 health correspondent Lino Madu. What do you have for us today, Lino?
Scientists say they have found a new compound that stops malaria in animal studies with a single low dose. The chemical compound fought early infection in the liver as well as malaria parasites that were circulating in the blood. The researchers from the Massachusetts Institute of Technology and Harvard University say the compound appears to wipe out parasites before they can multiply in the liver and be released in bigger numbers into the bloodstream. Tests in mice showed the one-off treatment prevented infection for the full 30 days of the study. Malaria is spread to humans by the bites of infected female mosquitoes. The researchers hope their early work could lead to new drugs for people. The study was published in the journal Nature. New guidelines for the treatment of 3 common sexually transmitted infections have been issued by the World Health Organization in response to the growing threat of antibiotic resistance.
Chlamydia, gonorrhea, and syphilis are all caused by bacteria. These sexually transmitted diseases are generally curable with antibiotics. The World Health Organization estimates that each year 131 million people are infected with chlamydia, 78 million with gonorrhea, and 5.6 million with syphilis. Dr. Nathalie Broutet is medical officer with the Department of Reproductive Health and Research at the World Health Organization.
Every day worldwide, there are more than 1 million new cases of sexually transmitted infections. These infections affect women, children, adolescents, men, and everyone everywhere in the world.
The WHO says these STIs have become increasingly resistant to antibiotics in recent years, reducing treatment options. Gonorrhea has developed the strongest resistance. Antibiotic resistance in chlamydia and syphilis, though less common, also exists, making prevention and prompt treatment critical.
WHO has just released new guidelines for gonorrhea, chlamydia, and syphilis to prevent antimicrobial resistance and to encourage countries to make treatment available, especially treatment like benzathine penicillin.
Benzathine penicillin was recognized by the 69th World Health Assembly in May 2016 as an essential medicine, but it has been in short supply for several years. The WHO is working with partners to identify countries with shortages and help monitor global availability of benzathine penicillin to close the gap between national needs and supply of the antibiotic. The new recommendations are based on the latest available evidence on the most effective treatments for these 3 sexually transmitted infections.
The correct treatment of these sexually transmitted infections is essential to control and reduce resistance to antibiotics. WHO has developed guidelines for the correct treatment and encourages countries to adapt these new treatments.
When left undiagnosed and untreated, these STIs can result in serious complications and long-term health problems for women, such as pelvic inflammatory diseases, ectopic pregnancy, and miscarriage. Untreated gonorrhea and chlamydia can cause infertility in both men and women. Infection with chlamydia, gonorrhea, and syphilis can also increase a person's risk of being infected with HIV 2 to 3-fold. An untreated STI in a pregnant woman increases the chances of stillbirth and newborn death.
Get this, a group of scientists in Great Britain is trying to create a chemical library of peptides contained in the venom of some deadly insects, hoping to find a powerful drug against drug-resistant superbugs. VOA's George Putich reports.
Many of the plastic living quarters of the 400 or so insects in this laboratory bear the ominous skull and crossbones, meaning that their bite can be anything from painful to downright deadly. Their venom contains hundreds of chemical components, each with a different target and effect, and that makes them interesting to medical researchers.
Some of them we've found actually can kill bacteria, bacteria like E. coli and Staphylococcus that are very relevant at the moment where modern medicines is failing. And we're also finding venoms that are modifying and killing cancer cells.
Finding new ways to kill bacteria is vital, since the excessive use of antibiotics has created some superbugs, like tuberculosis, that have grown resistant to the medicines we have historically used against them. Animal venom has already been used in medicines, but with about 100,000 different venomous animals in the world, there is much more to discover. Trim says Venom Tech researchers are trying to isolate and catalog those components, looking for the ones that could be turned into new drugs.
The principle of Venom Tech is separating venoms out into their component parts and targeting them to the right disease area. So this is the experience of the team in drug discovery of putting the right venom for the right drug target. So we maximize the hits, and a hit is an interesting peptide that might make it to a drug.
The insects are well fed in order to produce as much venom as possible, which is extracted in a way that doesn't harm the animal.
We anaesthetize the invertebrates, just put them asleep, makes it safer for us because they're immobile, they can't bite us, but also it's better for the animals as well. And using a very tiny electrical stimulation just to contract the muscle and squeeze the gland, so we get a small amount of venom produced.
Components are separated through a two-phase process called high-pressure liquid chromatography that yields about 100 proteins per venom. Each protein contains between 1 and 5 different molecules that may someday be turned into powerful new drugs. George Putich, VOA News, Washington.